Hello and welcome to episode 4 of SafeRef Stories podcast. I'm Laura Gaisley. I'm a manager in the Integrated Access and Flow Network, and I am the SafeRef lead provincially. Today, I am chatting with Odessa Zinck, charge nurse, Inpatients and Emergency at Twin Oaks Memorial Hospital. She's also a unit lead for phase 2 of SafeRef implementation. Odessa recently had an experience with a patient that was admitted to Twin Oaks. This patient was scheduled for long-term care, but ended up discharged home through the hard work of the staff and through the implementation of the SafeRef Patient Flow Medicine Bundle. So we're going to talk to her a little bit more about that today. Odessa, thanks for joining me on the podcast today. You were on our first episode back in the fall of 2023 at the very beginning of your learning journey. So welcome back.
Thank you. Glad to be here.
Great. So without revealing any identifying details for patient privacy, can you explain why the patient was admitted to Twin Oaks? Generally, what were some of their medical conditions or complications?
So this gentleman, of the age of 72, was admitted with the diagnosis of failure to thrive. Came to us in a state where his health was in poor condition, malnutrition, poor physical state. So just a general admission at that point. And throughout his stay, with nourishing this patient and trying to rehabilitate him, he had some unfortunate health issues where he ended up having a stroke in our hospital. We treated him to the appropriate services. He went to rehab and unfortunately didn't do very well at rehab, and then returned back to Twin Oaks to continue to dispo plan his discharge, and then had another sequence of events that were unfortunate where he became septic with an infection, which required him to have surgery, and then he returned again after that. So then his dispo plan continued on, and this patient was trending towards long-term care and was eventually put on the long-term care list. So that went on, and as many people know, waiting for long-term care from hospital can take several months. When we revisited many chats with his son, it was brought up in one of our family meetings that he was thinking about finding a way to bring home his dad. And that was the turning point. That was the light bulb moment where I was like, okay, let's start talking about this. So with the team collaboration and OT and PT and continuing care, we were able to work with the family and find a plan with resources, equipment, care that he required at home. And we were able to get him back in his home with his son and the rest of his family. So this was an extremely successful story, even though it had some negative aspects where his health deteriorated and he rebounded, and we continued to try to give him the best quality of life he could possibly have.
That's amazing. Sounds like some great perseverance by, the staff not only at Twin Oaks, but continuing care and all the different multidisciplinary team.
Yeah, it's definitely a group effort.
Yeah, absolutely. So how do you think SafeRef helped in this situation? Like, if you had to make a prediction, how do you think the situation would have unfolded without SafeRef?
I think what SafeRef brought to the table is it's the change in mindset, looking at things through a different lens, thinking about what are the options, and having that conversation with the family. So senior reviews, you're talking with the patient's family and everybody in the team and coming together. So I feel like with that new mindset, we think of it's not just the default to go to long-term care. Oh, this patient has this many care needs. This is an automatic long-term care situation. It's not. It can't. You just need to see where those, a lot of times, and what we're finding most effective with our SafeRef bundle is having that chat with the family. If they can give you some informal supports, you can add in the formal supports, and it makes it possible for that patient to get home, where we all know this is where most people are happiest. They're surrounded by their loved ones. This is what brings them joy. So Safer F kind of brings that lens to think about what this patient requires, what's keeping them still in hospital, what can we provide in the community so they can get out of hospital.
Yeah, that the mind shift has been really obvious to me, watching your team progress. I think the introductory sessions where you get that baseline knowledge and you start to really think about things differently from there.
And thinking about like how people's time is so valuable. These are people, these are not just patients or diagnoses. These are people. They have lives, they have families, they have things that they enjoy. How can you get them back to that?
Yeah, and really trying to determine what those goals are for that patient. What are those things that they really enjoy? I think that's really important to note as well.
Yeah.
Anything else you'd like to add, or do you have any advice to other units learning about SAFER-F?
I think my most valuable advice is having that family meeting early. It's something that we started to do, not realizing how impactful it was. It makes a world of a difference. You don't truly understand what that patient's lifestyle is like or what informal resources are available until you have that discussion with the patient, the family, and the team, coming together early as possible to see what the possibilities are to get them home, and what resources are available. What is the home like? What is important to that person? What risk level is the family and the patient willing to take? And I feel like that is the biggest turning point we have found effective here at Twin Oaks, is talking to families and patients as a group early on.
That's great. What do you think was the learning item or the key language that was used to get your team thinking about that?
I would say promoting that these people's time is valuable, and focusing in on, well, some of the language we use is like the clinical criteria for discharge. What is actually keeping them here? And repeatedly speaking about that in our bullet rounds. Okay, let's regroup here. What is the focus? So we all are working towards the same goal. Utilizing other tools like whiteboards where family can know what is keeping them still in hospital. The patient knows what's keeping them still in hospital. So they know, I need to work on my mobility. I need to walk every day. I need to be able to go to the bathroom by myself. These are the reasons I can't go home yet. So communication is the key. Spreading it throughout your team, spreading it to the family and the patient, so we're all working towards the same goals, and setting a date. What's that estimate date of discharge? Let's all focus on that. Can we accomplish it? Can it come 2 days earlier? Try to get them as home as quick as possible, because hospitals are not always the safest place to be. You can fall just as easy. You can get diseases, infections. So just trying to really focus on what is the reason they're still in hospital and communicating it all the way through.
Great. Thanks, Odessa. Thank you so much for sharing your patient story. I really appreciate your time, and all the best in continuing your learning journey with SAFER-F. Today, we were talking with Odessa Zinck, charge nurse, inpatient and emergency at Twin Oaks Memorial Hospital. She shared her experiences with a patient that avoided long-term care through the implementation of SAFER-F. Thanks for listening to the SAFER-F Stories podcast. Look for upcoming episodes on our YouTube channel. Thanks so much.